Many people, when they think about a chiropractor, they think of going to his office and cracking your back. I'm Dr. Howard Stranger of the Chiropractic Corporation here in Malden, Massachusetts. And the purpose of this video is to talk a little bit about cracking your back. Chiropractors really dislike the term cracking your back. We like to think of it as a chiropractic adjustment. A chiropractic adjustment consists of finding a specific vertebrae that is slightly misaligned and causing some sort of nerve interference. And this nerve interference needs to be corrected. And so the way that we do it is we find that specific vertebrae that's causing the nerve interference and then correct it. Now, many chiropractors use their hands. That's where chiropractic comes from. Chiropractic is Greek for done by hand. In my office, I don't actually use my hands. What I use is an instrument. The instrument is known as an activator. An activator is a handheld instrument with high velocity and low force. Here it is right here. It looks a bit like a syringe with a doorstop on it. Okay. Now, when we come up here like this, instead of using my hands to create a thrust, I use the activator, and it goes click, something like this. Many of the critics of activators say that, well, it doesn't really create any kind of force. There isn't any force in order for you to be able to create that impulse or that thrust that you need to be able to mobilize the joint and move the bone. Well, I have this demonstration model. See the blue marble? We're going to come up here and we're going to create an adjustment. And you see right here, there is actually some movement here on the part of the blue marble. So there is about 12 pounds of force each time that we click the activator. So this is real evidence that there is some sort of force that is involved with utilizing the activator. Now I want to give you a demonstration on a spine. Here we have a plastic model of your spine. You can see how these vertebrae are all relatively in a straight line, with the exception of this one right here. It is a little bit misaligned, right? Actually, in this particular view, it is greatly misaligned in actuality. It is a rather large example here of a misalignment. My purpose of it is to help you be able to better understand exactly what goes on here with a chiropractic adjustment. This right here is the vertebrae that we're going to adjust. The way that we do it by hand is that I'm going to come up here like so. I'm going to put both hands on it here like this, and then there's a thrust that's going to allow you to be able to get it put back in its proper alignment. Now, if we're going to do this by using the activator, in this particular case, what we would do is we would bring the activator here, and we would bring it to this position right here. And we would set up on this, what we call the transverse process, and there would be a click, something like this, and it would in fact put it back into its proper alignment. There is no crack as you do it this way. It is just merely a very subtle, very click, and it's painless, it's very, very gentle, and it is very, very effective at eliminating the subluxation or the misalignment and the nerve interference. This has been a demonstration of adjustments. First of all, there was manual adjustment, which was done by hand. And then secondly, there was an adjustment done by an activator. Both are very, very effective in helping people to get relief from various back problems using either method. This is the one that I use, and I find it is my preference, and it works very, very well in adjusting people's spines. I'm Dr. Howard Stranger of the Chiropractic Corporation here in Malden, Massachusetts, and my mission is to be able to help people get well and stay healthy through chiropractic care. Thank you for watching the video.